Hi, my name is Dr. Robert Wong. I'm a retina physician at Austin Retina Associates in Austin, Texas. The signs of wet macular degeneration are very important to recognize. So part of our job as retina specialists is to help educate our patients on recognizing the warning symptoms of wet macular degeneration, as early detection is critical to good outcomes. Patients who develop choroidal neovascularization, they may see a new dark spot in their vision or new distortion in their vision. So basically, straight lines may look like a new bump in them. Oftentimes, we educate patients to use an Amsler grid or an electronic monitoring system, such as the 4C at home device, and something as simple as just looking at a wall or a door frame to detect these changes. So when a patient comes in to see us with these symptoms, when we examine the retina, we may see subtle changes such as small pockets of fluid that may exist underneath the retina, or frank blood. Sometimes the clues just may be some yellowish deposits, which are called hard exudates, which represent leakage of fluid from the retina. It's extremely important to treat these blood vessels before they lay down a network of scar tissue, because ultimately, it's the scar tissue that leads to permanent vision loss. So the standard of care treatment for wet macular degeneration is achieved by inhibiting the growth of neovascular membranes with anti-vascular endothelial growth factor. This is also known as VEGF. Currently, this is achieved by injections of anti-VEGF medication directly into the patient's eyes with these teeny tiny needles. Most patients need injections on an average of 1 to 2, sometimes even 3 months between injections, and the large majority of patients will need to be treated indefinitely to keep these blood vessels at bay. And for many patients, coming in every month or so can be a burden. The newly FDA-approved Susvimo device may be a game changer. It's a sustained delivery device that is surgically implanted into the sclera of a patient's eye. And it's designed to release ranibizumab, which is an already FDA-approved anti-VEGF treatment. Now, this device is designed to release ranibizumab over a period of 6 months. The device has a refillable drug depot, which can be refilled in the office with a procedure very similar to an intravitreal injection. So that extra 6 months may be very helpful for our patients. The procedure is done in a surgical operating room with a standard sterile precautions, just like any other surgery. Initially, the overlying conjunctiva and Tenon's fascia is displaced with a few small incisions to allow access to the sclera. At about the same distance from the cornea as a typical intravitreal injection, we make a circumferential incision through the entire thickness of the sclera that is just wide enough to allow snug placement of the implant so that the body of the implant lies within the vitreous cavity, but the rim of the implant is flush with the scleral surface. Controlling of bleeding during this procedure is a must. And once the implant is placed into the eye, the Tenon's fascia and the overlying conjunctiva are reapproximated over the device to protect it from infection. Patients do understand that in order to have the best chance to maintain good vision over their life, we have to rely on anti-VEGF treatment to keep the blood vessels from wet macular degeneration from leading to a permanent scar. But for some patients, routinely coming in to see us as often as every 4 weeks may be a burden on their lives as well as their caregivers. The potential of extending this treatment to twice a year, as the clinical trial showed, or even longer in clinical practice, may be a boon for their quality of life. Well, it's hard to say. Every patient has a few patients in their practice that we would describe as non-compliant with their follow-up visits and may have historically suffered adverse consequences such as worsening vision from wet macular degeneration. And in some cases, that vision loss is irreversible. It's possible that a surgically implanted device may be of benefit for some that simply don't like to have frequent injections. Personally, I would want to make sure a patient has shown a history of compliance before proceeding with any surgical device implantation. With any surgical device implantation, we need to be especially careful when following a patient for infection, bleeding, inflammation, or in this case, erosion of the conjunctiva over the surgical implant, or perhaps even dislodgement of the implant. So even though reports of these adverse complications were rare, it's important to detect and manage these complications immediately and appropriately if they happen.